Welcome to Medical Associates Health Check. My name is Dr. Selvaraja. I am the clinical administrator for Medical Associates and the head of accident and emergency. This is an episode where we get back Dr. Bristol.
I'm back. All right, I'm Dr. Bristol. I'm a specialist physician in internal medicine, and I'm the founder of the Concierge Medical Clinic. So today, guys, we have two esteemed gentlemen with us. We're going to bring this topic to life. So we have Mr. Dave Ramnarine and Mr. Robert Ramcharan.
Good morning.
Welcome,
everyone.
guys.
Good morning. And
Thank you.
Pleasure to be here.
Nice. So today we starting it off hot and sweaty with back pain.
Yeah, well, this is a common topic.
Yeah. So back pain, I mean, it's pretty pervasive, I would say. It's caused a lot of stress, distress. In your professional opinions, run us through like why back pain and how common this problem really is.
Well, back pain, it's very common. 8 out of 10 adults will actually have back pain at some point in their life, and it's one of the most common causes of loss of work, absenteeism, and distress.
Mm-hmm.
And so traditionally, we've always thought of back pain as something that is seen in the older population. But personally, from my own experience, and Briss, I think you've seen it too, we're seeing younger and younger patients coming in through A&E and in your clinic. And
Almost like
that.
if as soon as you turn 30.
Yeah. When they say
you're back
over
in
the
there.
hill?
Yeah, as soon as you turn 30, everything is start to hurt.
Yeah.
And your back is the first thing I find that start to hurt. So, Robert, tell us, I mean, like, what might be the causes of back pain, that will...
So 30 is old for back pain. I mean, I've seen patients, teenagers with back pain, teenagers with a lot of back pain. And to be honest, both me and Dave have done operations on people and younger teenagers with back pain.
Right.
So not only 30 years old, but, even younger people are getting it. But you're right, it's more common as we get older because the most common cause, not the only cause, is degeneration of the back. Right, degeneration of the intervertebral disc, degeneration of the joints. What we call lumbar spondylosis is a technical term for it. The layman may call it a slip disc.
Right.
And then when that pain starts to go around the leg, we call that sciatica, okay, or herniated disc. So degeneration of the lower back is the most common cause of lower back pain we have. And then, of course, this causes muscular pain as well, too.
Right.
So as you're saying, there's more musculoskeletal problems causing it. But sometimes most people might come to your office and say, "Doc, I feel like I sleep bad."
Right. That's the common one.
That means it pushes you into thinking that this might really be mechanical in nature.
That's correct.
Right.
And the majority are. So, I mean, there are a couple of factors that we have to look in our lifestyle to prevent this sort of mechanical back pain and degenerative back pain. People who sit for long hours at a desk, we always say, you make sure you have an ergonomic workstation. And even with that, you get up every 45 minutes and you stretch and you move. You don't sit in one position for long periods, okay? Accidents, falls, it worsens degenerative disc, worsens degenerative disease of the back.
How you carry items as
how
well.
you lift things as well too. Your posture, your
Yes.
posture, bad posture. Bed is important. You have to have a firm bed. If you have an old, flat, stuffy bed, you're going to have back pain.
So the most common thing is probably, like you said, the degenerative disease, but there are uncommon causes. And Dave, maybe you could touch on some of the more uncommon
Yes,
causes.
certainly. Certainly for, especially if you have back pain earlier on in life as a teenager, then have you got a structural deformity in the spine, such as a scoliosis or a kyphosis? Is there an absent bit of bone? Or is
Before
there
we go further, can you explain what scoliosis and kyphosis?
So a scoliosis is a curvature, an abnormal curvature in the spine. If I look at the spine straight ahead, from the head to the sacrum, the spine should be a straight vertical line. But if there's a curve in this plane when looking straight ahead, then we call that a scoliosis. And scoliosis is fairly common. We often see mild scoliosis. And when we do x-rays, we do see it. But where it causes back pain is where the scoliosis throws the balance off. For example, if I'm standing straight and my shoulders are not exactly over my pelvis, it's almost like walking with a book bag on one shoulder for the entire day. So at the end of the day, the muscles in the lower back tend to be working
Yeah.
overtime and causes fatigue and
Yeah.
pain in the lower back. So deformities in the back can cause back pain. Now there are sinister causes such as tumors and infections. So if you have got someone with a history of cancer who presents with back pain, there's a possibility that the tumor has spread to the bony spine, and that causes quite a lot of back pain. So anyone who's elderly with a history of cancer, we need to have suspicion of any back pain, that it may be sinister in nature. If someone is immunocompromised, so they have diabetes, which is uncontrolled, they've had recent infection can affect certain parts of the spine, and where the disc spaces are, there's no blood supply. So if infection gets into the disc space, it can cause what we call a discitis. So if you're having back pain with fevers, chills, sweats at nights, then I think these are concerning signs.
So go on.
And like I mean, there are many other, I would say, non-surgical causes of back pain.
Yeah.
You know, that are sinister as well, not just the bones or muscles, right? You're thinking of the nerves, right? If these nerves are getting squeezed, as you would say in your sciatica, but we also have blood vessels that run in our backs, and
That's correct. I mean, not all the time back pain actually comes from the back.
No.
Because,
Correct.
for example, if you have an infection of your kidneys, sometimes that could present with back pain.
Correct.
If you have a ulcer that's perforated, sometimes that could present with back pain.
Even aneurysms, aortic
yeah, Dr.
aneurysms.
Bristol was going to say the saddest case is to have a aortic aneurysm and you think it's back pain and you miss
Correct.
that.
Yeah.
Correct.
Yeah.
Yeah.
So that's why it's so important to check your primary physician as well to make sure that this is really coming from your back.
I think that a lot of people will sit on back pain. Someone said, "Oh, we'll just wait a few weeks," and I want to press on the fact that we shouldn't. You should come and get seen and checked. Let us decide and do the relevant investigations and checks to make sure everything is okay, because waiting could lead to a more detrimental outcome.
Yeah. So in terms of the investigations, right? Back pain. Most people might say, "Oh, doc, what I should do?" And I agree with you. The first step is, getting in to see a doctor and, having a full physical examination.
That's correct.
Because it's not always your back, as you could say, it's not just bones and muscles, right? But going beyond physical examination
Well, I mean,
was the gold standard.
I can't emphasize the importance of physical examination, right? Your general practitioner is supposed to do a complete physical examination, right? He's going to make sure that the back pain is originally from the back. He's going to assess your neurological function, make sure you have no neurological compromise, okay? And then maybe not even after an investigation. Let's say Dr. Bristow wakes up this morning with back pain that he's never, and that's mild, comes in to see you, you examine him properly. He said, maybe take a couple of Panadol and call me in the morning. It may go away by itself. But there's certain times when we have to get into further investigations. And that's what important factor when we have to know when to get further investigations.
So let's stick a pin in that. We're going to go to break, and when we come back, we'll talk to you about the different types of investigations when looking at back pain. Don't go anywhere. We'll be right back.
I was diagnosed with colon and liver cancer. Hearing the news, I was devastated. Having to go overseas, that could be stress and away from your family. Medical Associate, there was no other place to go, and I'm glad that I did, because they made my journey even better. I'm more comfortable. They made me part of the family. So besides my immediate family, I now have another family here. I was asking about the cost, and she was like, "Don't worry, we could organize." So that was a burden taken off of my shoulder. It was like a personalized thing. It wasn't just like the cost, because I've heard that it's so expensive to do this, but they treat you as an individual. I would like to thank Dr. Raghunanan, the office manager here, the nurse in particular who is here with me during the chemo, and Dr. Bim, and also Dr. Solomon, because he was the one that did the colonoscopy, but they made me feel comfortable. I would recommend Medical Associates because, number one, the care that you receive. They make you feel comfortable and being part of a family besides your family. Because it's not that matter. What matters is to get you better. So I'm glad that I have this option here, and many other people will also have this option here if it is that they just do the research For everyone who is going through this, don't lose hope, keep the faith, and know that once you have a positive mindset, you can get through this. Together with the medical staff, together with your family, it can be done.
At Medical Associates Oncology Unit, we know every cancer journey is unique and deeply personal. That's why our team of expert oncologists, nurses, and specialists are here to provide you with world-class care right here in Trinidad and Tobago. From early diagnosis to advanced treatment options, we offer cutting-edge technology and compassionate support every step of the way. We're here to guide you emotionally, mentally, and we understand how costly treatment can be. So, we have reduced our prices to assist you financially as well. Every aspect of your journey matters to us. With expertise you trust and care, you can feel Medical Associates, the Caribbean's #1 comprehensive and internationally accredited hospital.
Welcome back, guys. So we were actually just getting into discussing the investigations for back pain. Sometimes you don't always need an X-ray, or you don't always need a thing. We really stress on getting a proper physical examination. But I mean, in some cases, you might need to go a little further. Dr. Ramnarine, you
Yes.
want to tell me what's the basic things that
Let's
people?
go step by step.
Yeah, maybe
So-
going up the ladder and see.
Like you said, I think we cannot emphasize enough the importance of taking a proper history and physical examination. And if you do have suspicion that further investigations are required, then simple X-rays to begin with, to look at the alignment of the spine, to see if there's any abnormal collapsed vertebrae. We just want to see the general shape of the spine. And but however, if we do have symptoms suggestive of nerve root compression, and if you've got lower back associated with pain running down the leg, okay, most people call that a pinched nerve.
Yeah.
We call it junjuni.
Yes.
Gingerly.
So you get
What?
so yeah, the older folks describe this sensation of tingling down the leg,
Yeah.
and they call that ginginy, and it is a real symptom. Tingling, numbness. Is related to nerve root irritation, and that could certainly be originating from the spine. If you've got any sort of neurological symptoms where you've got pain radiating from the back into the buttock, down the back of the thigh, into the calf, it could even go into the foot and the toes, then you suspect that there's nerve root compression, and an MRI scan is the investigation of choice. An MRI scan shows not just the bones, the alignment, but it shows the soft tissues as well. It shows the discs, it shows the nerve roots, it shows the spinal cord. Now, the spinal cord does not go all the way down to the end of the spine. The spinal cord ends at the upper lumbar spine. So lower lumbar spine problems do not cause problems with the spinal cord, but they cause problems with the nerve roots. And there's one instance where an MRI scan is done urgently, and that's if someone presents with what we call cauda symptoms, where they have difficulty passing urine, numbness in the buttock area, and this suggests that there's a large nerve root, a large disc herniation compressing not just the nerves to the leg, but the nerves that control the bowel and bladder.
So they can have retention of urine too.
Yes, if you have retention of urine or incontinence of urine, then it's urgent to get an MRI scan. And Cauda syndrome is an emergency that needs to be dealt with fairly promptly.
Yeah.
Okay.
But I mean, let's say, Robert, it's not just MRIs we could do or X-rays. Sometimes, let's say you have a traumatic injury. Is there a rule for CT scanning
That's
in those
right.
kinds of patients?
So we do have other investigations which we can do, and usually a specialist might decide on these. CT scan is the most important because CT scan shows us the bony detail way more accurate than the investigation, way more accurate than MRI scan. So we're looking for small fractures sometimes we call of the pars that could cause a subluxation. Yeah, we pick this up in a CT scan. CT scan, sometimes you give contrast with it as well too, especially when patients can't do an MRI scan. And you can't do an MRI scan if you have maybe some of the older pacemakers, maybe some of the older cardiac stenting, and then we need to do a CT with contrast as well too.
Right.
Ultrasounds are used sometimes.
Before you go down to the ultrasounds, can you explain what the benefit of using CTs with contrast is?
So the CT with contrast gives us more details of the spinal canal
Right.
and the nerve roots.
Yeah.
Okay, when an MRI scan can't be done.
Okay. And the ultrasound?
So ultrasounds not as commonly used.
Yeah.
Okay, they're not as commonly used or investigated. It's more if we have any soft tissue masses we're looking at. Rarely we'll use an ultrasound. We have PET scans, which sometimes can be used, especially in cancer patients when we screen entire cancer patients. Okay, and a final test we sometimes do are the nerve conduction test, or the EMGs, when we suspect a nerve is being irritated, pinched, and we're not sure of the cause of it. We run an electrical current. Our specialists who are neurologists will run an electrical current along the length of the nerve and tells us where the nerve is being irritated, where it's being compressed, and sometimes how serious it's being compressed with, and we have to do something about it. So those are our gamut of investigations we have to investigate the lower back. Am I missing anything, Dave?
No, I certainly think that covers the investigations that we do. In terms of spine development, because I do pediatric neurosurgery,
Okay.
I see the children who have spinal defects or born with spinal defects or spinal bifida, and this is very important to ultrasound. Antenatal ultrasound can actually pick these up before birth, and we can actually anticipate the kids who are going to be born with spinal defects.
Sweet.
And how do you prepare for that? What are the options?
Well, we do counsel the expecting mother, and once delivery, the baby's delivered, then we examine the baby's back to see whether surgery is required or not.
Right.
In some instances, we do have to operate within the first 2 days of life.
Okay.
Yeah. I mean, these investigations, I mean, they're all available at Medical Associates.
They are, yes.
Probably with the exception of a PET.
Yeah, we don't
Right.
have PET CT.
PET is positron emission, right?
Yes.
So that's fancy stuff, new stuff. It is available locally. It's expensive, but it's really good, right? Especially in the case of cancers, detecting metastases or spread to the bone. Apart from those investigations, the CT itself with contrast is very useful for the medical causes of back pain, right? Uncovering vascular disease, especially in the abdomen and lower limbs. So I think, it is very useful to have CT as well for those kinds of patients.
Because it doesn't just look at the neurological issues, it also looks at the kidney issues that we were talking about, the vascular problems. Now, you had mentioned, Dave, that the back pain, the back pain that radiates from the back down into the buttocks and the back of the leg. What are some of the more uncommon symptoms seen with back pain related to neuropathy?
Again, so we spoke about the urinary symptoms.
Yes.
Okay, so it could be either if you've got cord equine syndrome, compression of the sacral nerve roots, you can get urinary incontinence or retention. You could actually have fecal retention or incontinence. So if anyone has symptoms like that and numbness in the perineal area, then it's important to investigate this fairly promptly.
So we have patients that will come in and say they've got, tingling in their feet and sometimes we have people, I don't know if you've seen them, Bristow, but I've had patients that say they have pain down the front of their leg. It's not always the back.
Anterior
It's the
thigh.
anterior pain. And it's easy to ignore that. So it's important to point out that patients could present either way.
That's correct.
Yeah, but in terms of all these investigations, I think, it's pretty clear. Sometimes you need an extra test.
Yeah.
Yes.
But then we want to get into what you can do after you investigate and how you treat this back pain. So, guys, we're going to take a little break right now. We're coming back. And when we come back, we'll be discussing how we treat your back pain. Stick with us.
AI technology is changing healthcare. And at Medical Associates, our new AI-powered MRI scans give you clearer images in half the time. That means faster reports, greater accuracy, and less time in the machine. all designed around your comfort. It's pain-free, stress-free, and right now you can get $800 off your MRI at our St. Joseph branch. So call us now to book at 662-2766, extensions 4072 or 4073. You're in the hands of the #1 comprehensive and internationally accredited hospital in the Caribbean. At Medical Associates, we make it easier to get the clarity you need with the care you deserve.
Our CT scan services are quick, comfortable, and designed to detect internal issues early, often before you feel a single symptom. Because the best way to treat something is to catch it early, and Medical Associates makes that easy. Just call or WhatsApp 342-7061 to book. It's that simple. You're in expert care at the Caribbean's #1 comprehensive and internationally accredited hospital. Don't wait for signs. Take control of your health with ease and confidence at Medical Associates, where care always comes first.
Welcome back. Before the break, we were talking about symptoms and tests for back pain, but now we're going to get into the nitty gritty. We'll talk about how to treat your back pain. So, what are the options available for treating back pain, Robert?
So, of course, I mean, your first assessment is going to be by your general practitioner, your primary care physician, your local health center, right? Once you mentioned, we've said it again and again, they'll take a good history from you. They will examine you properly. They will decide if an investigation is needed to be ordered to find out what the cause of your back pain is. We've gone on and said that the most common cause is muscular pain, musculoskeletal pain, or maybe a little bit of degeneration of the lower back. Okay?
And sciatica, that's the one we hear.
And sciatica as well, too. Good news, at least for this forum, is that less than 5% of patients with back pain ever come out of surgery.
Okay.
And that's great news. So, an important examination is important because we want to make sure that we're not missing anything, any nerve compromise, anything that could cause you to lose permanent function. Make sure that you don't lose any bladder function, right? Once we have this sorted out, then our first management of acute back pain usually is going to be some rest, okay? You're going to give you some analgesia. We usually give you anti-inflammatories, muscle relaxants, and a lot of back pain, majority of back pain usually do improve within 4 to 5 days. Once we get this improved, we get the muscle spasm and the severe pain out, then we now work to correct your lifestyle. Okay, so we look at what you've done to cause this back pain, your sitting position. If you're lifting too heavy, you lift properly with a straight back. And the importance of strengthening the back cannot be emphasized, right? And I refer most of my patients to a properly qualified physiotherapy to get a proper program with them. And physiotherapy doesn't mean that you have to go every single day by the physiotherapist, right? But they will set you up with a home program. They will set you with exercises to do at home. And the most common thing I see is that a patient will come in to me, they come in with back pain, they will go to the physiotherapist. I've seen them in a month's time and say, Doc, I have no back pain. Everything is great. All the pain on my leg is gone. And then I see them back in 2 years' time and say, Doc, the back pain is back. I said, how's the exercise going? Oh, I stopped that long time.
Yeah.
That's the most common thing I see.
And apart from just lifestyle modification, part of it also goes to simple things like diet and managing obesity.
We can't speak about smoking as well, too.
Smoking.
People don't realize that smoking causes degenerative disc because of the poor blood supply we spoke about before.
Yeah, so I mean, in terms of treatment and, as I said, physiotherapy, there is a role for qualified, certified physiotherapists and chiropractors in managing back pain. But in Trinidad, we have a famous person called a cracker man, right? And that man is literally bend your body up, crack you up. You feel a release. But then some people, when they go home, say the pain get worse, right? And it's probably because they probably have now entrapped a nerve that was not entrapped before. So, Doc, what do you think about
that? That's correct. Most back pain is musculoskeletal, and most back pain will actually improve with that treatment. But if there's nerve compromise, if there's nerve compression, then yes, certain manipulations can cause worsening of that compression and worsening of the symptoms. So you've got to be very careful with who you seek out in terms of treating your back pain. And if you do have any pain radiating into the legs, into the feet, then I think it's probably worthwhile to seek medical advice.
Prior to getting your manipulations on.
That's correct.
Yeah.
All right. Yeah.
So we talked about ultrasound in the role of diagnostics, but actually ultrasound can be used in the treatment of back pain. Is that not right, Robert?
That's correct. So when you go to a physiotherapist, they have a couple of modalities which is treating you. So they're looking to treat the fascia, the muscles, and the soft tissue, okay, to get it relaxed, to get a better blood supply to it. And they have ultrasound techniques to use. They have infrared techniques to use. They have TENS, the transcutaneous electronic neurostimulator, where they put the little shocks in the back as well too. They even home machines for them as well too. There's dry needling, which is our Western technique of acupuncture. That's correct. That's correct. So the many modalities our physiotherapists have, and we have very good physiotherapists in the country now. Just make sure when you go to a physiotherapist, if you come by me, I will recommend certain physiotherapists I use around the country. But anyone you go by, just make sure they're properly qualified as a physiotherapist.
We actually have a very good physiotherapy department in Medical
We
Associates.
do an excellent one.
Yeah, I'm very proud of them. I've actually had treatment for my back pain with them. So we've talked about these different non-invasive options. Let's have a quick discussion on what surgical therapies are available. So Dave, would you like to start?
Well, I think we have the full array of surgical interventions for treating spine conditions. The most common condition we would treat would be lumbar disc herniations and lumbar spine stenosis. So lumbar disc herniations tend to occur in the younger adults, whereas spinal stenosis occurs in the older population. So a lumbar disc herniation will present with lower back pain, pain down the leg. They would have failed conservative management, meaning medications and physiotherapy would not have given them relief. And I would usually send them for at least a 6-week to 3-month course of physiotherapy. And if they've had no relief, then I think they failed conservative management and they would require surgery. Okay, so for lumbar disc herniation, we would do a microdiscectomy. In the old days, we'll do a laminectomy and remove the disc fragment, but now we have become more minimally invasive, doing microsurgical decompressions with a very small cut, and the patient's up and about right away.
On the same day?
On the same day. And most patients will go home within a day of surgery. I've had some patients go home on the same day as surgery. For the older patients who have spinal stenosis, their symptoms are slightly different. They get what we call claudication type symptoms. So they get up and they walk 10 meters and they get this cramping pain going down the back of their thighs and into their calves. They're not sure if it's their circulation, but most times it's coming from their spine. If you think of a pipe rusting, the cross-section area of that pipe gets smaller. It's like that in the older age groups, where the spondylosis results in thickening of the bone that surround the spinal canal, narrowing that spinal canal. So an operation called a laminectomy or a limited laminar decompression can relieve that pain and improve their walking. And age is not a limiting factor. I've operated on patients in their 90s for this condition, improving their quality of life.
And it helps a lot. And when you see those older people, who could only walk for a few meters and they walk bent over to try and increase the diameter of that spinal canal.
And release the pain.
And release the pain and release that pain down the legs. Yeah. And they love when they're in the supermarket, they hold onto the cart so they can walk bent over, give them a lot of relief. So we know that's when the spinal canal is narrow and those nerve roots are being compressed. Yeah, and they benefit a lot from a simple widening of the spinal canal called a lumbar laminectomy.
Okay.
Nice. Any role for implants? Like when you take out a disc?
Yes. So if there is a slip in the spine, what's called a spondylolisthesis, and the patient has instability pain. So in addition to the pain going down the leg, they have a lot of back pain when they move. In certain selected cases, we'll opt to fuse the spine. Yeah. And we do so by putting in screws above and below the slip and linking those screws up to create almost a scaffolding holding the spine together. And this is a fairly safe procedure. And with modern intraoperative X-rays, we can certainly see exactly where we're putting the screws. Yeah. And when we remove the disc, we put an implant where the disc was, called an interbody cage. And that despite the screws and the rods, the patients often describe less pain in their back than they had before surgery.
Okay. Well, thank you very much. I am sorry, but that's all we have time for today. But we do appreciate you both coming on and having this discussion. It was worthwhile. And just to let you know, Medical Associates is actually running a special for the next 6 months. We will be offering a discount on back surgeries. So call us for more details on 662-2766 and come through to our customer service team on 4028. Thank you for watching. We will see you next time.